just something I want to talk about because a friend raised it on another post. This is about mental health services, and I need really to get your opinion. It seems to me that obviously every profession has a series of standards by which it operates. That makes sense, doesn't it? I mean, my son is training to be a nurse, and if you're a nurse, a doctor, a psychiatrist or whatever, you would expect to operate by certain professional standards and codes of conduct. Certainly I know that if you are a nurse, you would be expected to be scrupulously honest, and if you had any criminal conviction or anything like that, you could lose your certification with the Nursing and Midwifery Council. But my point is really a bit more subtle than that. Professionals, mental health professionals, physical health professionals, are not immune from, if you like, the politics of the situation. I want to ask you this, especially for those of you who've been involved with mental health services. Somebody on my Facebook feed was saying that they felt that the response of the professional looking after them was almost based on that professional's political view. They said, and I think it can actually be rightly said, that if these people are drawn from a kind of middle-class background where they've obviously had a good education, I'm not suggesting that they are not professional. I'm not suggesting that they're unqualified. I'm not suggesting that their education hasn't rightly fitted them for what they choose to do. But if they are treating you and helping you, is it not also very possible that this kind of establishment view of what we should be moving towards, this politically defined view of what is a functioning, healthy, stable human being, is it not possible that somehow that influences their perception of you and how they treat you? Let me be honest with you. The number of times that I've ever been spoken down to by a mental or physical health professional, I could probably count on less than the fingers of one hand. Yeah? Simply because I won't have it. I won't allow it. It really won't happen. Yeah? I am prepared to use the brain that I have, the understanding that I have, and the reading that I have done to say, wait a minute, don't speak to me like that. Don't treat me like just because I am the patient, I am kind of incompetent, I am worth less, and your sort of understanding of what should happen to me should be that as some kind of over-anxious parent. Don't do that, yeah? But my point is this. As the Tories increasingly begin to define, almost politically, what is mental health, as they get to a situation, and I've written a paper about this, which I've published many times, where they believe that work is a health care outcome. How long is it going to be before your therapists, your mental health nurses, your psychiatrists are going to be moving you along to that state whereby if you are out there either working or job seeking, you are mentally well. In other words, if we get, and I can see this happening, to a point of associating work with wellness, then suddenly you've defined a whole new illness. Not working is a sickness. Not working is a disease. Not working is a pathological state. That can't be right. It cannot be right to have the state and the prevailing government's political agenda incorporated into the work of healthcare professionals. Do you know the other thing that strikes me from talking with them as well? You have now to be very guarded about what they might share with others. You've got little or no chance now for privacy of your own information. Very, very shortly, elect another Conservative government, I am absolutely sure it will come. Everybody within the DWP and Job Centre Plus will be entitled, at the typing of a few security codes, to the history of your physical and mental health. All those things you thought were just between you and your health worker, you and your doctor, you and your social services person, all those things that you had thought were confidential and were part of your treatment. If you elect another Tory government with this idea that everything is one and working and serving the economy is all that is that life's about, with this idea that if you don't work you're ill, and if you're ill and non-productive, really you should just die. Yeah? Think about it. Next time you see a doctor or something, think about that. Seriously. Think what you reveal. And doctors, you need to look at that too. Because how can you really treat your patients if they're afraid to tell you what's really wrong? Think about it. I know I said it would be short, but that matters to me, and it was prompted by something I read and an experience I've had as well. Take care, and don't forget to go out and vote tomorrow. Bye-bye.